Hello, I'm Jill Webb from Jill Webb Training, and what I'm really pleased to present today is a video to remind you about CPR. What do we do when someone's not breathing? You'll be aware, if you've been on one of my courses, you'll have heard that the Resuscitation Council reviews these protocols every 5 years, and we've updated this video to make sure it's really up to date for you. So just the first step, reminder, the 3 C's. We're going to check, is it safe to approach our casualty? Is there anything that could cause damage to us, further damage to the casualty or any bystanders? Are we in the middle of a busy road? Is there a flood? Is there a fire, etc.? We're then going to check, is the casualty responding to us? And if the casualty is not responding to us, we're going to make an immediate 999 call before we do anything else. And then if the casualty is not breathing, we're going to do CPR. So there's your 3 C's. Check, call, CPR. So just a reminder from other videos, the first thing we're going to do is our doctor or our C, so danger, check, checking for danger. We're going to check for that response. Fred, are you awake? Come on, mate, can you hear me? If I've not already phoned 999 and I know that I've got Nathan in the office next door, I might shout, Nathan, can you come and help? Or I might get my phone out of the pocket, phone 999. Make sure you know how to have your phone on loudspeaker. We're then going to check for any catastrophic bleeding. Remember, that's the bleeding that will spurt out. We'll know that it's there, and we're going to deal with that by applying direct pressure or a tourniquet. Then I'm going to check for breathing. So I'm going to use my head tilt, chin lift, open up that airway first of all, and then I'm going to look, listen and feel for 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10. And I've either got no breaths or I've got very poor breathing, perhaps agonal breaths, really gaspy breath, someone's really unwell, in which case I'm going to perform CPR. However, one of the things that's changed is the requirement to get an AED, and we'll talk about AEDs in a moment, really quickly. So if I am by myself and I know there's an AED under the boss's desk or at reception, I run and get that, even if it means leaving the casualty. Otherwise, send someone to get one. While I'm waiting for the AED, I'm going to immediately start CPR. So I'm going to kneel beside the casualty, I'm going to put my dominant hand out and lock my non-dominant hand into it. I'm going to head for a line, which if you imagine an imaginary line underneath Fred's armpits, I'm going to go along with that halfway and I'm really going to push hard 30 times. 1 and 2 and 3 and 4 and 5 and 6 and 7. And you'll see that I'm doing nice smooth compressions. High quality smooth compressions are proven to be more effective. I'm not jabbing, I'm doing nice high quality compressions. I'm hardly actually coming off the chest at all. I like to think of it as a circular motion. Once I've done 30 compressions, I'm going to do 2 breaths. So I'm going to pinch Fred's nose, I'm going to tip his head right back, and I'm going to make a seal around his mouth. And you'll see I did 2 quite short, sharp breaths. I'm then going to start with my compressions again, then do my breaths again. And I'm going to continue that cycle until an AED arrives. So let me just pause and explain to you what an AED is. An AED is an auto-external defibrillator. This is the thing that is increasing out of hospital survival rates by between 50 and 70%. So if you do one thing after watching this video, I urge you, please go and find out where your nearest defib is. It might be a local shop, a local leisure centre or whatever. There's a picture coming up on screen and that will show you what a defib looks like, the kind of thing that you're looking for. Once you find out where it is, find out how to access it. I heard a really awful story the other day of a local shop that very proudly handed over a defib to somebody, but it was locked and nobody had the code to get in. So make sure you know how to get into it. If you have a look on the British Heart Foundation website or HeartSafe, there are lists of where you can find defibrillators. They'll never be completely up to date because it's a private purchase. There's no sort of need for people to register them online, but it's definitely worth having a look to find out where they are in your community. But keep your eyes open as you go round. Once you've got a defib, it will come in some sort of package. This is a training one, but it's very similar to how one will come. And you're looking straight away for various different things. You are looking for a base unit. It might be that you take it out. Occasionally, particularly in say a large factory which is high risk, the base unit might be on the wall. There'll be some sort of base unit, or dead straightforward. In a minute we're going to press green to put it on. We're looking for some pads. Either we'll have two sets of pads, one for children, one for adults, or we'll have one set of pads and a switch on the AED between child and adult. They're the key things we need. You hopefully also will find some scissors. If we've got clothing on Fred, we just cut straight down it. We don't worry too much about underwide bras anymore. We used to be told we had to get them off. The balance is that it's better to save someone's life and we can deal with a fairly minor burn injury later. There hopefully will be some kind of cloth. Fred might not be nice and clean. He might have been sick as he's fallen down. He might have fallen in the mud, and we need to wipe where we are going to put the pads so that electricity can conduct between them. And then there should be a razor. If Fred is well endowed with body hair, you might quickly need to again scrape where you are going to put the pads, because we need to be putting the pads onto clean surfaces to conduct electricity. So with Fred, I've got my adult pads ready, so I don't do anything apart from follow the instructions.
Remove pads from package and apply to patient's bare chest.
So I've removed the pads from the package and I'm going to apply to the patient's bare chest. It shows me where to put them.
Plug in pad connector next to flashing light.
One there, and following the instruction, one there, as near to under the armpit as you can get it is the latest guidance.
Plug in connector.
So I've applied the pads, I'm now going to plug in the connector.
Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Charging. Stay clear of the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is safe to touch the patient. Start CPR.
So honestly, all I did was follow the instructions. I didn't even need to deliver the shock because the machine did it for me and it told me that was what it was going to do. Sometimes you'll have to deliver the shock. The device will let you do CPR for another 2 minutes and then it will run through that again. Hopefully by then the very least you've got is the emergency services on the phone to support you if you've not actually got a first responder with you. So the top advice I can give you is listen to what a defibrillator says. If you've got lots of people and lots of noise, get them helping you keep the patient's modesty, standing around while you listen and do what it says. People that have used a defib have told me 2 things. The first thing is the 20 seconds while it's assessing heart rhythm feels like the longest time in your life. Hold your nerve, don't let anyone touch the patient. And the second is that although the casualty won't massively jump like they do perhaps in Casualty on the television, they will be some movement and that can be quite startling. The key message from this year's review of all first aid procedures with the European Resuscitation Council is we need to get that defib on as quickly as we can. So if a colleague comes with a defib, you carry on with the CPR, get them placing the pads and everything. From the moment you find someone not breathing, they need CPR and they need defib to keep them alive. There's no time. I spent lots of time because I was demonstrating, but you want to be doing one or the other all the time. Okay, so as we end, I want to just talk about children and babies. The really, really good news is that it's dead simple, because just like if you've watched the video about unconscious casualty, I said an adult and child are the same. So it is with children and CPR. The whole protocol is the same. There are 2 exceptions. For younger children, probably aged about 8 to 10 and below, we use 1 arm for CPR rather than 2. We're trying to depress the chest by about 1/3. I'm not going to give an exact age, because you know as well as I do, some children are adult size at 10 and some are really small. So use your common sense to dictate that. Apart from that, the protocol is the same. For babies, things have changed. So let me just get my baby, who sat very nice and quietly for the whole of the demonstration. So I'm just going to move Fred out of shot so that we can see the baby. If a baby's not breathing, and the ambulance dispatchers are really good at describing this if needed, we now use our thumbs. So we're holding the baby around the back, we're heading for the same place as we always did, just below where that line between their nipples is, and we are using our thumbs like that. As straightforward as that. It's amazing, isn't it, that little things like that can save lives. So when we are working with children and babies, if we are trained to do so, so if you've been on a first aid course, you may alter the ratio to 15 to 2. If you've not been on a first aid course, it's suggested that you get practical practice first, so you would stick with your 30 compressions. In fact, you'd probably be doing compressions only. But if you are trained in paediatric life support, 15 to 2 increases the success rate. I told you about using a defib on a child. We use the pads, the smaller pads. What we do is put 1 behind and 1 in front, but that's very clear on the packet. We use a defib on a baby when advised to do so by the ambulance service. So I know that's been quite a lot of information to take in, but we just felt this time round it was more useful to put all the information about all the age ranges on one video. We hope you agree. Take some time to watch it again and digest it, and if you've got any questions, get in touch, or indeed use the comments below and we'll get back to you. Thank you.